Hello, my name is Laverna Whitcup from Ford Insurance Agency. In this presentation, we're going to talk about understanding your Medicare options. Today's meeting, we are going to talk about what is Medicare, when am I eligible to enroll, why do I need more than just the original Medicare, and which plan is right for me, a Medicare Advantage program or a Medigap program. In this slide, you're going to see what is the original Medicare. Up in the upper left and lower right, you're going to see what a Medicare card looks like. It's red, white, and blue. It's kind of a chintzy paper card, and it will come to you when you're Medicare eligible or when you sign up for Medicare. In the Part A hospitalization part of Medicare, you have hospital care, skilled nursing care, hospice, and also you'll have a home health care after hospitalization. In Part B medical insurance, this covers your doctor's fees, your outpatient hospital visits, other medical services, and supplies that are not included in Part A. Both Part A and B have deductibles before coverage starts. Part B typically covers 80% of medical services. Original Medicare does not cover all of your medical costs, only up to 80%. Original Medicare does not include prescription drugs. It does not have an annual out-of-pocket limit on your expenses. So what that means is that the 20% that you pay goes on forever. What if I want more coverage? In addition to original Medicare, you can choose to purchase additional coverage from private insurance companies. There's Medicare Part C, which is called Medicare Advantage programs. You also want to buy Medicare Part D because guess what? The government penalizes you if you don't have that. And then you also can purchase Medigap policies or Medicare supplements. Those two are the same thing, so don't let yourself get confused with that. How do I decide which plan is right for me? Medicare Advantage or Medigap policies. With Medicare Advantage, you have the original Parts A and B of Medicare. Then you have additional coverage to limit your out-of-pocket costs. Plus you have healthcare extras and resources that we'll go over in a little bit. And then it also can include prescription drugs. When it includes prescription drugs, these are called Medicare Advantage prescription drug programs or MAPD. Or you can have the original Medicare, Parts A and B. Then you can pick up a Medigap plan. You pick that up through an insurance company. And then guess what? You got to buy separate prescription drug coverage through another insurance carrier. Medicare Advantage plans may be right for you if you like paying lower premiums. You want original Parts A and B plus additional benefits and services. You like the idea of having one plan, one card for all of your medical and pharmacy needs. You prefer predictable co-payments on all of your services. You want the protection of an out-of-pocket limit. And you want to save money by using a network of physicians. What is Medicare Advantage? These are health plans that are offered by private insurance companies to give you additional coverage to your Parts A and B of Medicare. Are you getting the picture that no matter what we do, you got to have that Part A and B coverage? That's what you have to have. When Medicare Advantage plans include Part D prescription drug coverage, they're called MAPD plans. MAPD plans are usually the best way to get the lowest cost plans with Parts A, B, and D all together in one package. MAPD plans may also include extras like dental, gym memberships, fitness programs. There's a lot of extras in Medicare Advantage plans that you really need to know about. With MAPD plans, you have just one card and one insurance company that you deal with for all of your medical and pharmacy needs. How do Medicare Advantage plans work? Well, first of all, you have that Medicare Part B coverage, and then you've paid into the Social Security Trust Fund all of your working years. Also, your employers have paid into that. The money that you pay from Medicare Part B and all those dollars that you paid in all the years that you were working from Social Security taxes, they go into the Medicare Trust Fund. The Medicare Trust Fund then pays your Medicare Advantage premium. The Medicare Advantage premium goes to your insurance company. And then your insurance company manages and coordinates all of your insurance, creates and gives access to a network of doctors and hospitals. And then they also administer all of your services, billing, and enrollment. They also pay all of your claims. It's a one-stop shop with Medicare Advantage plans. When am I eligible for Medicare Advantage? You must have Part A and B We've said that many times. You must be a permanent Michigan resident and reside in our service area for at least 6 months out of the year. You can't be denied for pre-existing conditions. When can I enroll in a Medicare Advantage plan? Well, there's 3 different areas that you can do that in. First of all is called your initial coverage election period. The second is your annual election period. And then the third is special enrollment period. The initial coverage election period, this is a 7-month window which begins 3 months before your initial enrollment to Part A and B of Medicare, usually your 65th birthday month. You can elect to have the original Medicare, Parts A and B, and add extra coverage like Medicare Advantage or Medigap plans and or Part D prescription drug plans. If you don't sign up for Medicare A and B when you are initially eligible and you don't have other creditable coverage, you will receive a late enrollment penalty when you do sign up. The annual election period is between the dates of October 15th and December 7th each year. During this time, you can choose to remain on your current Medicare Advantage plan. If you don't want to make a change, you don't need to do anything. You can enroll in a Medicare Advantage plan if you haven't enrolled in one before. You can switch to a different plan if you are already enrolled in a Medicare Advantage plan. And then your coverage starts over every January 1st. The special election period, this is a period outside of the initial coverage election period and the annual election period. This is when an individual can change his or her current plan, and here are some examples of that. If you move outside your plan's service area, if you are enrolled in both Medicare and Medicaid, if you qualify for low-income subsidy, if you lose creditable coverage from your employer, if your plan is no longer offered, and last but not least, if your plan is terminated by Medicare. Now let's talk about the Medicare Advantage open enrollment period. This allows you to change your Medicare Advantage plan or disenroll from your plan and return to the original Medicare. You must already be enrolled in a Medicare Advantage plan. You also may add or drop prescription drug plans, which is the Part D. There's only one plan change that is allowed. This occurs between the dates of January 1st and March 31st each year. For new Medicare beneficiaries enrolling in a plan during their initial coverage election period, it occurs from the month of the entitlement to Part A and B, the last day of the 3rd month of entitlement. And then the effective date is always the 1st of the next month. Now let's talk about Medigap plans. These are optional supplemental benefits. And remember I told you that Medigap and Medicare supplements are the same thing. These plans are supplemental insurance that may cover costs that the original Medicare doesn't cover. The federal government standardizes all of these plans. So if you look at a G plan, for example, with one insurance carrier and a G plan with another one, they have to be identical. You pay a monthly premium for a Medigap plan. And Medigap plans do not include prescription drug coverage. You have to purchase a separate Part D plan when you purchase a Medigap plan. When am I eligible for a Medigap plan? When you turn 65 or older. In order to get Medigap coverage, you must be enrolled in Medicare Parts A and B. You must be a permanent resident of the state of Michigan. If you are under age 65 and eligible for Medicare due to a disability, you may be eligible to enroll in Plan A or D in the Medigap world. When am I eligible for a Medigap plan? You're eligible during your open enrollment period. This is the 6-month period beginning the first day of the month in which you are both age 65 or older and enrolled in Medicare Part B. During your guaranteed issue period, you won't be denied or get an increased premium due to pre-existing conditions. Questions are always welcome. Please feel free to call me at my direct line or email me if you have any questions. I'm always ready to help you with all of your Medicare questions. Thank you.